morning is like so
Good morning, ladies.
And then
No gentlemen in the room. So, they already know everything, exactly. What, have you been hanging around with my husband? So, I want to thank the Foxborough Council on Aging for having me be here today. My name is Brenda Stewart, and I'm with a company called Two Sisters Senior Living Advisors. And I go around to councils on aging and talk with people about being prepared and being informed about your options for your future. And there are lots and lots of options, and of course, lots and lots of costs. And we're going to talk all about that. And we were supposed to do a slideshow, but they are having technical difficulties today. So I have to make a bargain with all of you. I have a handout for you and some pens so you can take notes, but you have to promise me you're not going to skip ahead, because if I see you skipping ahead, then I'm going to get off track. Can we make that bargain?
Yeah.
Okay.
So you're saying two sisters. Do you have a sister who works with you?
Actually, I do not. The company was formed by two women. I wish I had a sister. The company was formed by
Stop to say hello.
The company was formed by two women who are sisters 7 years ago.
Okay.
And often when I say I'm with two sisters, people start looking around for a nun. They're real sisters. So I feel like I'm so far away from you guys. So let's start with the very first slide. And this is all the statistics. Is there enough to go around? Oh, and here are
We're
pens.
missing one here.
I wake up.
You need a pen? All right, here, I'm going to pass the pens around in case anyone needs it.
Did you say you had pens?
They're coming around.
Oh, okay, thank you.
Okay. So let's start with the numbers, the statistics, while you're all still awake. Want to make sure you're. We get the boring stuff out of the way. It's actually it's double-sided, so it's at the top. So there are 10,000 people turning 65 daily in the United States until the year 2030. Think about that.
Is there an extra one?
That's a lot of people. And 70% of the people 65 and over are going to need long-term care at some point in their lives. So there's lots of people in the United States, 328 million. But only a very small percentage of them have actually planned for their long-term care. And most people say, I'm never going to need that. I'm going to be really careful. I'm never going to need anybody to take care of me. So the sad reality is that only 2.5% of people have planned for their long-term care and have planned ahead. So that's the numbers. And some people call it the silver tsunami or the senior tsunami, but we've got a lot of people who are going to be turning 65. And so the good news is you have lots and lots of options. The bad news is you might not have planned for it financially. And we'll talk about that. So the senior tsunami affects everyone. It affects the adult child who may be looking after or worried about a parent. That adult child may have to take time off work if the parent falls, if the parent has a diagnosis, if something happens in a crisis. It certainly affects spouses. I work with many, many spouses who are caring for a loved one. A lot of them are caring for a loved one with some form of dementia. I have another presentation that I hope to come back and do on when memory care is needed. It affects the employees. They've got to take time off from work. It affects their bosses. They've got to give the employee time off. Projects don't get finished. It affects neighbors who are maybe helping with shoveling, mowing the lawn, doing the grocery shopping. And it also has created a world of professionals that stand ready to help you. There are senior real estate specialists They're not just regular realtors. They have a special accreditation in understanding what it means to sell someone's home when they've been there 40, 50, 60 years. So there are senior real estate specialists. There are senior move managers who help people all the time and downsize and go through 40, 50, 60 years of stuff. There are elder law attorneys. And I will say, if you have not met with an elder law attorney to get a health care proxy in place and a power of attorney in place, you need to do that. If you have done that and you haven't had it reviewed in the last 5 years, you need to do that too. Then there are financial planners. So this senior tsunami does affect everyone, and I think the figure that stands out, and I get AARP magazine, and the figure that stands out in one of the recent issues that I read is that 43 million adults are caregivers. So the senior tsunami truly is affecting everyone. And it can be overwhelming. You have many, many choices. Where do you begin? There's all sorts of terminology. There's Medicare A, B, C, D. There are CCRCs out there. It's sort of like an alphabet soup. You know, what does this mean? What does that mean? And people in the industry fall into the trap of using the quick lingo. Then the other big question is, what is affordable? What can I afford for my life if I decide to move out of my home? And then the big challenge that we try to help people with is making apples to apples comparison. The industry does not make it easy for the consumer. There are all different types of pricing structures. There's all different types of care levels. There's all different, there's rental options. There are buy-in options or entrance fee options. So we want to make sure that when you're comparing things, you're really making apples to apples comparisons. Now, if you're somebody who likes to get online and Google and find out about things, you need to be careful because there are many online agencies, and you might think that you're on a website of a particular place, but if you happen to give your name and phone number and have a conversation with someone who's very nice, who's online and might be in a remote area of the country, you may wind up getting inundated with phone calls. If you say, sure, I'd like to learn a little bit more about that community, then you may share a little bit more of your story, and your story gets shared with 12 or 15 communities, and they all call and very politely ask you to come into lunch, check it out, which is a great thing. But in terms of having someone help you weigh all of the options, that might be something that you want to think about. We operate a little bit differently than that. We work with people. We have lots of conversations up front, and we don't share contact information. It's up to you to share contact information.
Scams on that too.
And and we all are hearing about the senior scam. So, you know, even the technology it's there to help you, but sometimes just requesting information can result in unsolicited calls. Or calls, unwanted calls, solicitation calls. So, the next slide really talks about, it's a little graphic, this little guy on the little red road, where do I go, where do I start? Independent living, skilled nursing, home health care, senior housing, adult day. These are all some of the options that are out there, and we're going to talk through each one at a time. So let's start with home health care. Everybody I talk to, let's say probably 90% of the people I talk to want to stay at home. Who doesn't? Everybody wants to stay at home. So that is absolutely your prerogative, and technology is making it much, much easier to stay at home. What I tell everyone is that you need to compare all of your options. Private home care can cost anywhere from $22 to $35 an hour, and is everybody on the home health care page where it's listed there? And if you think about this, let's take an example. Let's say you have a fall or you have surgery on your shoulder and you're having a hard time getting dressed and showering. So after you've gone to rehab and Medicare pays for the portion of your time, you'll get sent home with some help. But that's not long-term. So let's say you need help with that, and you hire a private caregiver to come into your home. Most private care agencies have a 4-hour minimum. So let's take the lower end of the range and keep the math easy. So 4 hours a day, 7 days a week. 4 hours a day is $100 an hour. And if you have that 7 days a week, that's about $3,000. Now let's say you've got some real mobility challenges and just getting up and down out of the chair. Let's say you've had hip surgery. Let's say you've fallen. Whatever the scenario, you need someone 8 hours a day. So now let's double that 3,000 to 6,000. Now you're at home, you're getting the care you need, you're also paying property taxes, you're paying for your food, somebody's still got to do the shopping and the cooking, and your homeowner's insurance. So all I'm saying is that, yes, everybody wants to stay home. Technology is absolutely making it easier for you to stay home. But what is your plan? What is your plan B if you cannot stay at home? And where is your financial break even? At what point are you going to be paying more in private care to stay in your home? And I am not kidding when I tell you that I'm working with families all the time who are spending $16,000, $20,000 a month for private care in their home. So that's the reality. You need to look at your numbers. A little, okay, everybody's all serious now, so let's lighten it up. Think about the last time you bought a car. You went out and you looked at consumer reports maybe, or maybe you didn't care, you just liked the color and wanted to make sure the seat was comfortable. But maybe somebody you were looking at the car with was looking at miles per gallon and looking at safety ratings and doing all their research. Think about the research that we put into making a car purchase. Why don't we put that same amount of research into our future? What do you want to do in the future? And what are your options given your budget, given your potential care needs, and given the location that you may want to be in? Depending on your budget and your care needs, you may not get the location of your choice. So that's my I guess, rule number one. If you don't remember anything else I say today, remember, you got to do your planning. Your life and your future is way more important than going out and purchasing a car. So do your planning for yourself. So a little bit more about home care, what's included with that. You can have a high level of home care. If you need a nurse to come, absolutely nurses can come. Certified nurses assistants will come. You can have all sorts of adaptive equipment put in your home. You can have meals delivered to you. We have a wonderful service here through HESCO based in Sharon. You can have all sorts of medication dispensers put in your home where they'll beep and whistle and tell you it's time to take your medicine. You can have one of those life alert necklaces or bracelets where if something happens and you need emergency help, you push that button. The other option is adult day health. Maybe someone is at home caring for a spouse with dementia. There are adult day health programs where the person can go during the day and be supervised and be engaged, and that's another option. You can stay home and you can still get support through the day. And that's usually about $100, so depending upon what's needed, it's an option that goes along with home care.
Are there adult day health centers in this area?
Yes, there are.
Oh, there are? Okay.
Yep, there's one in Mansfield, there's one in Norwood, there's one in Westwood.
Thank you. Is that $100 a day?
It varies. So in the case of someone with dementia, you can have, the caregiver may need a break to go shopping, to go do whatever. So someone could come in the house for 4 hours, and that might be 100 plus, or someone could go from 9 to 3 and be around other people and be at an adult day setting. So that's an option, yes.
Can you explain aid and attendance?
Aid and attendance. Where is that?
the end.
Oh, there it is, aid in attendance, yeah. Okay, so that's how it's paid for, sorry. Aid in attendance is a veteran's benefit. So if someone is a veteran or surviving spouse of a veteran or there's a veteran in the relationship, there is an aid and attendance benefit that would help pay for assistance. It's a government benefit that takes a while to navigate the process, and there are also asset restrictions. So some people will be eligible for that Veterans Aid and Attendant benefit when they qualify.
Reduce
And
it
it's just-
as your money winds down.
As your money winds down, yes. And there are veterans agents in every town who can talk you through whether someone is eligible. They have to have served, had not, cannot have had a dishonorable discharge, and various requirements, but a lot of it is financial. Then there are also third-party vendors who can expedite the process. The government may take a year, for example, to tell you that you're eligible and do all of the paperwork. There are third-party vendors, you pay a fee, but they can cut that time in half and really navigate that process for you. So that's the veterans benefit.
Would a mother be eligible for that?
A surviving spouse?
A
Oh,
mother.
a mother of a veteran. Good question. I believe it needs to be a surviving spouse or the veteran, him or herself.
Okay, so
But I don't know.
but the surviving spouse could be.
Yes, yes.
When you
Yep,
run
and
out
it's
of money.
definitely something that you would want to talk to the Foxborough Veterans Agent about. They would
She's
know-
wonderful.
they
She's,
would-
Allie is wonderful,
Yeah,
and
she's
she's really good, so.
Yeah, so they will know more about that
We should have her speak.
than
Yeah, you should.
I do. All right, so now let's talk about independent living. The cost for an independent living apartment, depending upon location in the area, can be $2,000 to $8,000 a month. You're all still sitting. You're not throwing anything at me. That's good. That's good. So independent living, we're talking about a maintenance-free lifestyle. In the senior living world, we're really not talking about the 55 and over condos. That's really a place where you own and you're moving to, but there may or may not be stairs. There's really not a lot of programs, and there's no services available. Independent living has the sense of, a huge sense of community. It's maintenance-free living, elevators, no stairs. There is usually a meal plan involved. Most often it's one meal a day, sometimes a continental breakfast. The apartments can be lovely, full kitchen because you are expected to cook and shop and do all of the things because you are still independent. Your utilities are usually included. They have transportation to doctor's offices if you're no longer able to drive. And they also have trips, and they bring entertainers in. And some of the people who come to the Council on Aging go to these communities. Any of you heard of Gary Highlander before? So Gary, I don't know how Gary keeps track of his schedule, but he's everywhere. So the things that you like to do at the Council on Aging can also happen in an independent community. There's a very rich social lifestyle. And there are a whole bunch of things we could talk about people staying alone in their homes and not being engaged in conversation and sociability, and not having a lot of fun. And I think that, I started out saying at the beginning that probably 90% of the people that I talk to don't want to leave their home. They're staying home until they take me out in a box. I've heard it all. And yet, when they go to a community and after they've gone through the adjustment process, they say, I wish I'd done this sooner. I'm having a ball. Yeah.
Where are some of those around here? then?
Yeah, that's the next question.
So there are many of them around here. There is Mansfield Willow Crossing. There, and I'll get to the pricing structures in a minute, but there are There are many, many, many. There are some in Canton, there's one in Walpole, there are Franklin. There are lots and lots and lots of communities. And so there are books that have lists. But again, you want to kind of do your homework and understand the costs and what some of them mean and how they're structured. You don't have to call and go visit 10 of them.
The social worker here would probably be a good start, resource.
Yes, yep, yep, she's a good resource. And sometimes she will call me when she's working with a Foxborough person who is overwhelmed by all the options and wants someone to just help navigate. And so, yeah, there are books and directories, and you have a lot of choices. You have a lot of choices. So one of the things with independent living, there are different financial structures. There are entrance fees or buy-ins, and there are strictly rentals. And the way that that works is with a buy-in, you are paying up front for that apartment. A one-bedroom could be $389,000. So you pay that amount up front, and your monthly fee will be lower than another kind of model, which is a rental, where you just go month to month, but you haven't locked up that money up front in the entrance fee. Now, a lot of people like the entrance fee model because they've worked really hard, they want to save their nest egg, they want to have something for the estate, they want to make sure that their kids are taken care of, and they want to just put that away. And in a life care community, which is another twist on all of this, in a life care community, your monthly fee is capped. It's kind of like buying a long-term care insurance policy. But you have to be able to afford that entrance fee. Then there are communities that are strictly rentals. The monthly fee would be higher, but you can get out of a rental with a 60-day notice. And you know what when you sign that lease, if it is an all-inclusive type of place, you know what your monthly fee is going to be for the year.
Can you back up to that entrance fee? So you pay $389,000, your monthly cost is less. What happens to the $389,000?
That $389,000 is usually 90%, 95% refundable,
So
depends
that's
on the
fine.
place.
Okay.
It's sitting right there, and
When you pass, that goes.
when you
to-
pass or when you move,
Oh,
or when
okay.
when you decide to go, but
Okay.
I will say, the terms of the refundability, when do you get that 90% back? You need to read that contract very
Okay.
carefully. Some places guarantee that you'll get your 90% back within a year after you leave. Or when someone else moves in, whichever is sooner. Other places say, you'll get your 90% back when someone else buys it. And we don't know when that's gonna be.
Okay.
And so it's a very, very good option for some people. And there are pros and cons with all of the options. So at a rental, you sign a lease for a year, you'll be paying a higher amount, but you can also leave with a 60-day notice.
Right.
The other thing I should say is that monthly fees, the fees typically will go up 5% a year in this industry.
Okay.
I've seen them as high as 7. A few years ago, they were lower, maybe 3. So for your planning purposes, figure 5%.
Whether you rent or buy in.
Yeah. Yep.
What's the percentage of people that can afford $2,000 a month? I mean, you're looking at somebody that's on Social Security and has maybe a very small income otherwise, and they're not getting $2,000 a month.
It depends upon how much they have saved over their lifetime. You know, if they've got a pension, it depends. There are places in towns not too far from here where buildings are full and their rents are very high. So it depends on everybody's personal financial position. I don't know the percentage. I do know.
That's what you should get when you get out of college.
Exactly. Well, and that's the thing. People are not talking about healthcare costs until there's a crisis. And so what was my first mantra, my first rule?
Plan ahead.
Thank you. Yeah, that's why. Okay, so
65, it's a little late.
the other thing on independent living is senior housing. A lot of people say, well, I'll go into senior housing. Senior housing is based upon one's income. And a lot of towns have a wait list in excess of 2 years. And you will not be getting care. You'd be back in that situation of having to pay for care to come in. So I want to make that distinction between independent living in the senior living industry and senior housing. Does that make sense?
Yeah, what's CCRC?
So CCRC is part of that alphabet soup I was talking
Yeah,
about. Continuing care retirement community. So that's a community where they have independent living, assisted living, they may or may not have memory care, and there's a skilled nursing facility on the same campus. A lot of times the skilled nursing facility is not necessarily owned by the same company, but all of the services are there. And the idea is that you can age in place, progress through the continuum. Yep,
Thank you. Those around here?
there are.
Do little one towns where you find that.
Walpole?
No, Willow Crossing is not skilled.
Newport Village?
Yes. Yes. So, yeah, so the question is what around here? The closest that comes to mind, and typically I don't talk about specific places because they all are very different. But New Pond Village is a CCRC for the most part. It's really, they're calling it a life care community. So it's got 176 independent apartments. It has assisted living, it has memory care, and then it has Harrington House, which is now called Walpole Health, and that's owned by a separate company. But someone who can pay an entrance fee can move into New Pond Village and progress through the continuum because it is a continuing care community or a life care community.
But the New Pond Village is actually an independent living? They have?
New Pond Village has 176 independent apartments, or 167 independent apartments. Yep. They have a very, very small, and so here's the issue with continuing care retirement communities. They have the bulk of their building is for independent folks, and when people need care, they transition to assisted living. But if it's a huge, huge independent complex, that assisted living will likely be full. As part of their life care program, when you need assistance, you can go to any one of their other communities. And if Walpole is your preference, then when there's availability in Walpole, you come to Walpole. But that's the idea.
So it's smaller.
There's a smaller amount of assisted living, but the whole idea is that the people who are already there have, by virtue of that entrance fee, staked a claim on their future.
What about,
Okay, now what
is
about-
something in Rentham called Pond something?
Yeah.
Pond Home in Rentham, it's not a CCRC.
Oh, yeah.
No.
That's a reservoir.
Pond Home is, well, it's sort of, Pond Home has independent homes, and then it has a rest home. Yeah, so a rest home is kind of a hybrid in between assisted living and a nursing home. Their certification from the state allows them to do more things than the assisted living is licensed to do. That make sense? All right,
Can I ask you
So-
one question more about Willow's Crossing? Okay.
Yes.
The cottages are independent living?
Yep.
Okay, now the main building there is?
Assisted living and memory care.
Okay, and so,
And that's,
they have a memory unit,
yep,
I still
and that's not, they don't have,
but they don't have skilled nursing, so they're not a CCRC. Right. Yep.
So whether you're renting or you're buying in, I mean, you have that fee you have to pay when you buy in, and then when you're renting, it's a lease of a year, so those costs can all go up. It's nothing locked in when you go into these places.
So the monthly rental, just like if you were renting an apartment anywhere,
Every
your
year.
monthly rent will go up every year. Yeah, regardless
And the
of the
monthly fee on
structure.
the people who own is the same thing.
The monthly
Well, it
fee
might
on
go up, but it
people
can be
who,
capped.
that can go up.
Oh, it can be
Yes.
capped? They say sometimes it
That
cap
can
it,
go up, yeah.
but the
yeah.
rental
But it's
isn't
different,
capped.
it depends upon the community itself and how they structure it. So they're all a little bit different.
You know what it
That's the
makes
main-
me think?
That's, go ahead.
But when you live in your own home, say in this town, like the monthly fee that goes up for us indirectly is the taxes, the water bill, and all those other ancillary things.
Yep. So the community has to pay all of their staff.
Balance.
They have to pay, the community has to pay their taxes, they have utilities, yes, yeah. So those costs are passed
Right.
along, okay? So we ready to move on to assisted living? All right, here's my rule number 2. Here's my rule number 2. Assisted living. Don't practice ageism. And what I mean by that is don't ageism. You've heard of sexism? Don't practice ageism. Just because the sign on the building says assisted living, there are wonderful people living there. I talked to a man yesterday who said, well, my brother-in-law is not disabled. I said, of course, he may want an apartment with some help. He lost his wife, he may not want to cook anymore. Nobody said he was disabled because we suggested that he consider assisted living. There are people in assisted living who may have a spouse who needs some help. There are people in assisted living who may not want to cook 3 meals a day anymore or pay property taxes. There are people in assisted living who want the peace of mind that care is there, available when they need it. And that's the big difference between assisted living and independent living. Independent living, you bring in care. You pay privately for care. Assisted living, they have caregivers. Now, some of them include care in their monthly fee, some of them don't. Here's where we get into a variety again. Yep.
Another issue with independent living and bringing in care is trust.
Yes.
Who are you letting into your house?
That's yep. That's a big issue.
Trust.
So with home care, there are pros and cons to every option. Some people absolutely want to stay in their home and forever. There have been articles in the paper about, caregiver. Yes, caregiver fraud. Right here. Oh, they're back there. Okay.
Thank you.
So yeah, it's just people have wonderful experiences with home care. Other people, I hear it all. At the end of the day, it comes down to what you want and you can afford, but there are certainly questions that you should be asking to vet a home care agency. All right, so back to assisted living. Assisted living has the ability to meet your activities of daily living, or your ADLs, back to the alphabet soup. And that is dressing and bathing and grooming and toileting and transferring and medication management. Those are all services that you can get in assisted living. Again, they're very different. Some will include the care in their monthly fee. Some will charge a lower amount for the monthly fee and have levels of care. So you pay for what you need as you go. Some people like that. Other people like the idea of knowing what their monthly bill is going to be. So
you can go into one of those assisted living places as an independent person and pay less?
yes, you can go into an assisted living place as an independent person and pay less. And when I said don't practice ageism, there are people in assisted living who are not getting care. There are many people who are getting care because the reality is, the reality is that most people are staying in their home way too long and really need care when they go into assisted living. But there are people, like I said, there are spouses, there are widowers who want companionship, just want socialization and don't want to cook. So just because the sign says assisted living on the building, don't assume that everybody is, everybody is gonna need help.
They do have to be there only if you need.
That they have to be there. People choose to be there.
Yeah, I see.
And the other little mantra I have is about practicing ageism. I can't tell you the number of 85-year-olds I talk to who tell me they don't want to be around old people. I don't want to be around old people. So I have a true story to tell you, and one of your own members is going to elaborate, but this is a true story. I helped a gentleman move into New Pond Village when I worked there, and 75 years old, and he came in and he said, I sit around my house and I look around, I'm like, why am I staying here? His wife was in a memory care community, and so he was home alone in his house. He said, I think I need to make a change, but if I come, I'm really going to come over here and I'm going to kick the tires and I'm going to come and visit. And I said, you come visit every day. You come until you're comfortable. You meet the staff, you meet the team, go talk to the maintenance guy, go see the boiler, I don't care. Do what you need to do to get comfortable. And he did. He happened to have a passion for history. And he moved in. It wasn't Gary Highlander, but he moved in. Now remember, he was 75 years old. And he was in the lobby every morning having coffee and laughing with this guy. And the person that he was laughing and having coffee with every day happened to be a former history professor from Boston College. So this 75-year-old's passion happened to be history, and he met and became friends with someone who shared that same passion. So you've heard the phrase, you're as young as you feel, age doesn't matter. It really, truly, in every community, there will be people, no matter how old you are, there will be people that you can meet. And if you're a people person and you like listening to stories and you like having things to do, that's a good thing for you. So I just spontaneously, I heard a story, and I know that she's talking about the history professor. Will you share the story that you just told me?
Yeah. Should I stand?
Sure.
Yes. I'm not good. I'm not eloquent. I had to find and discern the difference between Pond House and the other, the one we're talking about.
New Pond.
Pond.
Yep.
And Walpole. Found my way there because I had a fabulous neighbor, very personable. In that circumstance, I met him actually. We always walked our dogs and would run into one another. And they were elderly. He lived alone with his wife, never had children. I'm giving too much background. The long and the short is, we, as neighbors that were fond of him, tried to encourage him. Both had medical issues, but he was having a dementia issue. And she wasn't very happy with her nose in a book. So the long and we talked about Willow Crossing, get him engaged. He's a sociable person. Well, he has ended up at New Pond Village, and I thought I have to get over and see him. Finally got over this past week. What a beautiful facility. I was amazed. But he's in the memory care, not the creek, which we were trying to encourage.
No, it's memory care.
It's memory care, but it's part of, the assistant living, they have their own apartments. I was leaving after having this visit with my friend and just checking the place out. Retired nurse, you check the nooks and crannies without them knowing. And I sat in the lobby for a minute getting something out of my purse. And this gentleman was over sitting in a chair, and the next thing, I started getting these questions. Well, he was very nicely dressed, clearly very intelligent and funny and engaging, and I'm a Gabby Gus, so I had no problem. You want to talk, I'll chat with you. I think you're pretty nice, and I am friendly. And so the next thing we had chit-chatting away, and I thought, is this the Inquisition or what? He had so many engaging questions that he engaged me more because I was fascinated with his mind. He clearly was extremely bright. And I just, well, where did you grow up? How many husbands did you have? I said, now, that's off limits. That's personal territory. And that's when I said about it. But he was just such a joy to because I didn't engage that with
And
my
you asked
friend.
him what and found out what?
So he was asking me how old I was. I said again, off limits question. I tell everyone. But I was just loving that bantering that he seemed to be engaging in. And I said, but I'll flip that question around, how old are you? And he said, I'm 101.
And guess who he was? Guess who he is? That
And
history
never
professor.
did
Oh,
I,
no.
never
The
did
history
I
professor.
believe
The other
on
guy.
earth, because he was a great kidder. He asked me if I knew what PITA was, and I said, PETA, it's a brick. Where did you grow up, he said. And then he told me it was pain in the ass. And I said, is that
That's totally the professor.
Is that for me? But the thing is, I grew up where they called it PIA, and we just had this bantering. She turned around from the desk when he was engaged with another person that is currently going in for some sort of counseling or whatever. And I said, keep me out here. He thinks I'm going to go. Yes. And she said he just moved from
Assisted living, or from independent living over there to
after
America.
being, I would have loved this guy even in memory care. I would have.
And you would have loved him in
I just
independent
told
living.
Brenda,
So-
I think I'm
Good
gonna
job
go
there,
back
Mary.
and visit my neighbor more often.
And that's the thing. We're all people.
Oh, he
You
was
know,
wonderful.
We all have our stories, and that's one thing that happens all the time in these communities is people talk about their stories. They find things in common. They find people they may know or passions they may know. So it really doesn't matter what age people are, as long as they're doing what they love to do. And it really doesn't matter if someone has memory loss, as long as that person is able to do what they love. So we're going to talk a little bit more about that. In terms of assisted living, there's one more little asterisk there. There are some subsidies available. So that means that there are some assisted livings that have subsidy programs so that when your funds are becoming depleted, you may stay there at a reduced rate. The subsidy programs, unfortunately, are becoming few and far between. And it's something to just keep your eye on and be aware of. And certainly if you need to explore subsidy programs, I would say the sooner the better, because they are so few and far between that people move in and spend down while they're living in the community in order to have a spot on the list. And some of the communities have a 2 to 5 year wait list for the subsidy programs. So they exist. It's a whole other realm unto itself, but it is there. So this is kind of what we've talked about so far. We've talked about independent living, we've talked about assisted living, and there are a couple more categories that we're going to talk about. But remember, independent living is, there's not care, and it's 1, maybe 2 meals a day. There are a couple places that offer 3 in the area. But traditionally, it's 1 meal a day. You're going to have a giant, beautiful apartment with granite countertops, and you'll be expected to cook your own meals. Assisted living is that apartment with help concept. Okay? And then there's some kind of hybrids in here between assisted living and skilled nursing, like assisted living that offers these levels of care. And they're providing care service in the assisted living community that a few years ago was only offered in a nursing home. And that way people can age in place and stay there until they die, getting the services they need, depending upon their care needs. So assisted living has really evolved in the last few years. And then memory care assisted living has evolved. And we're going to talk about that next. So memory care is going to include all of the things that independent living and assisted living provides. But on top of that, there will be much more opportunity for social engagement, for supervision, for redirection if someone is confused and maybe doesn't know how to find their way to the dining room. Memory care assisted living is a wonderful, wonderful thing. It is expensive, $5,000 to $12,000 a month. However, if you think about what happened with people with dementia years ago, this is a wonderful opportunity for someone to have a team of people supporting them all day long and talking to them in a reminiscing kind of way. People with memory loss may not know what they had for lunch. They may not know the time of day or day of the week, but boy, if you get them talking about something from their childhood, or if you get them talking about history, the 20s, 30s, 40s, they will have a great time talking with you. They just need to be treated with respect and dignity and engaged. And I think, I won't go on my soapbox about memory care, but the world needs to become dementia friendly. People need to understand what it's about and know how to communicate with people. And people with dementia can live joyful lives, and they're living in the moment because the moment is all they have. That's what they remember. And so there are communities where there are memory care communities that have a huge calendar of programs, and people have choices about what to do. Increased staffing ratios, and they can get checked on overnight. There are also special design features with lighting to reduce the effects of sundowning late in the afternoon. Specially trained staff. I used to do the dementia training. And it really does take a village and a team to keep someone feeling good about themselves and active and engaged. So that's memory care. And then there is skilled nursing.
Can I just tell you about memory care, Mike, because I'm living this?
Yes.
So you need to look specifically at the program. I find
Yes.
there are a lot of group programs. So if people are all together, because you do have higher staff ratios, but everyone's together. So if you want to take a nap by yourself, and sometimes that's a struggle because they don't have enough caregivers to do some of that.
Yeah. So if everybody heard her comment, the key to memory care, and if you're doing a search for memory care, we always advise people to look at that program calendar. How many, if the person's passion is music, how many live concerts are they offering a week? Do they offer parallel programming so that if program A is happening, but they don't want program A, can they go back to their room and take a nap, or can they do program B? So a lot of it is really doing your homework, doing your investigating.
Yeah, a lot of homework.
A lot of homework with memory care. All right, so skilled nursing, and that's really the final continuum. So skilled nursing in Massachusetts, the average is, and I say skilled nursing, some people say nursing home. I kind of use them interchangeably. Skilled nursing is $15,000 for a bed in a room. So if you can be in assisted living at $7,000 to $10,000 a month, it's still way better than skilled nursing. Now, skilled nursing is the one thing that is paid for by Medicaid for people who run out of funds, who have $2,000 or less in assets. And in general, you don't need to be in skilled nursing unless you have a wound that needs to be dressed daily, if you really need a nurse 24/7, if you have a feeding tube or ventilator, if you have that need for a medical model. A nursing home is that medical model. Assisted living is an apartment with some help. Is that a good distinction?
Yes.
Okay. And that's the one thing that our system will pay for if we don't have any money left. So, again, you're not throwing anything at me, so that's good. The next is hospice. And hospice isn't necessarily a place, but a kind of care. When someone goes on hospice, they generally have a diagnosis of 6 months or less, and they have a team of people to support them. Doctors, nurses, social workers, chaplains, and the equipment. If a hospital bed is required, if certain equipment and medications are required, that is covered, excuse me, that is covered by Medicare. And there are people, you can have hospice wherever home is. So if you're in an assisted living community and you need to be on hospice, you have that level of support there. There are also hospice centers where people can go, but a lot of people prefer to be, some people want to be in their home. And hospice offers grief support, I think, for up to 13 months after your loved one has passed. So that's hospice, and we're just going to quickly wrap up here. There are all sorts of professional services out there. There's your area aging service access code, your ASAP. Back to the alphabet soup. That's HESCO. And I don't even know what HESCO, health, I forget what HESCO stands for. Yeah, but, yeah. So HESCO does the Meals on Wheels. It has the Shine. Shine is your insurance options. There's COAs, Councils on Aging, your senior centers. There are geriatric care managers, GCMs, who are now life care, aging life care professionals. A GCM will charge an hourly rate, or they may have a flat fee up front, but a GCM is great for cases where an individual may not have any adult children involved, and as they age, they want someone to be involved with their care and advocate for them, go to doctor's appointments with them. So a geriatric care manager can offer a spectrum of services. There is a fee for that. And I mentioned before, there's move managers and downsizing specialists. There's senior real estate specialists, elder law attorneys. Go get your healthcare proxy and power of attorney checked if you've got it, and if you haven't, get it done.
I heard, you said 5 years that you need to renew it again. To get your, updated for your healthcare proxy, so forth.
Yeah, I mean, if
had
you
heard-
haven't had it looked at in a while, you should have it reviewed.
Well, I'm under that, but I had heard 3 years was the total, now you're saying 5, which one is it?
If you've heard 3 from an elder law attorney, I would go with what they say.
Yeah.
3, yeah.
Yeah.
Okay, yep. Financial planners, sit down and look at your financial picture. And then there are senior living referral services. There are those that are online, there are those that are like Two Sisters. But you do have resources. And kind of circling back to the main point, which was what?
Plan ahead.
Plan ahead. That's really what we want you to do. So how do people pay for these services? Most of it is private pay. And again, if you can't afford the place in Walpole, maybe you can afford a place in a different location. Long-term care insurance. We know that a very small percentage of the population has that, but those that do are pretty golden. That's good. There are bridge loans. It's very expensive.
Keeps going up.
And it does keep going up. And they say that, age, you can still get it, but I think that there's kind of a baseline of around age 60 or 65. And then after that, it does get more expensive, but.
I got it at 70, no.
Good, so you got it though.
Yeah.
But it is expensive.
My lawyer said never not pay it.
Right.
No, never get another one.
Yeah,
like
if you
it.
have long-term, if everybody heard that, if you have a long-term care policy, don't miss a payment ever.
No, they would love me to miss it.
Yeah.
Is there a cap on that too? If I got into a position I needed someone to come in daily, but a few days a week.
So your policy will have what the payout is on it.
So the cap,
There is a
I
cap.
could go through it that way and never end up using.
But check those caps.
So you need to check, you need to check the fine print of your policy, because
Well-
every policy has a different payout amount.
Give me a policy or a contract, that's where I need the elder attorney.
But actually, you don't need an elder law attorney. There are people who specialize in helping
Oh, okay.
people get that policy activated. I spent hours on the phone trying to activate my mother's policy. There are people whose sole job is to advocate for people trying to activate those policies.
Oh, thank you.
So so we talked about the Veterans Aid and Attendance Pension, and then there are life care settlements. If you have a whole life policy worth a lot, there's a way that you can cash that out and use that toward your care, depends upon the amount. We talked a little bit about the subsidies. There is a low-income housing tax credit subsidy. There are annual income caps. Again, a lot of the communities that have the subsidies have internal waiting lists of about 2 years. So if you know that you may need a subsidy, your funds are going to run out, this might be the time to go have a chat with the communities that offer that. And then, of course, there's Mass Health for those who need Medicaid to pay for the services. So that's.
Which is the majority, it seems, correct?
I don't have actual numbers and statistics to absolutely say it's the majority. I mean, we happen to live in a high net worth state, so,
You know,
yes, so
there's
that's,
an alternative, I wondered if you're familiar with it. Remember what they did on Beacon Hill? You may not, you may be too young. But they had the Beacon Hill plan where everybody stayed in place and it was done. And now that there's a similar one, if you want to look at one, where I could go and live in an apartment in Providence or
Oh,
a
yes.
certain area.
yes.
And I interviewed them and they did it's amazing. And I think we can do the same thing here, so, but it would need guidance.
Yeah.
I mean, in Foxborough.
And,
In Foxborough.
yeah, I need to find out more about that.
It's
There are
It's
starting to
incredible
be
what
some
they do.
places like that.
You have handyman, you have everything.
I don't know what the cost is, though.
Well, there's a basic fee, which is very low.
Yeah.
It's a couple $100, I think.
Yeah,
There's a lot of
It's
people
a-
that donate to it.
yeah, it's a different model.
Is it
No.
a building?
No, they have an office there. I put all that stuff together and gave it to the town planner here years ago.
So,
Yeah,
that's the end of the, that's the end of
Yeah.
the slides, but
Pages
I
on
see a
town
couple
planner,
questions.
Yeah,
Yeah, okay. So, yeah, I don't know much about that, but,
well, it's really worth it.
She's- yeah.
Because they could use someone like you also in that whole respect of how to do it. But check
Yeah.
the-
I need to go
check
find
the,
that out.
Beacon Hill one, because that's old.
okay. It is, it's been around a while.
about that somewhere.
Yeah.
Okay.
Can I just make a comment?
Sure. Well, let me see what her question is.
My question is, I'm looking at Willow Crossing in the individual cottages, and I'm pretty well set, and I think I've done my homework. But in talking with my elder law attorney, of course, these fears come in over the years, and I've talked with a financial planner, and he said, yeah, we can do it. What happens when you own this and you run out of paying the monthly fee?
So, that's a very good question. And it should be in the fine print when you go to sign the lease, and you're gonna want your elder law attorney to review that lease for you. But because you have this chunk of money sitting up there, many communities allow you to start drawing down.
So it's like a reverse mortgage, actually.
A little bit, and it's also like if you're able to cap that monthly fee, yes, but you would want to make sure that you can start using that amount that you've locked up toward your monthly fee.
Thank you.
Hi, I've been looking at CCRCs where everything's covered for life. You have to be independent when you go in so that they think you won't, pass away quickly.
You have to pass their medical
Right.
assessment, you have to truly be independent.
My question is, should I keep my long-term care insurance? Will they pay
Oh.
will that pay the monthly rent if you need assisted living?
Your long-term care insurance will pay.
Even in the CCRC?
Oh, yeah, I mean, your
Okay.
long-term care insurance
So you
should
wanna
pay
keep
for
that.
your care. So that's a question, is do you need that particular kind of model if you have long-term care insurance? And I don't know the answer to that.
Well,
I mean,
mine is
it just-
capped at a certain dollar amount.
Okay,
Yeah.
all right,
And I like the activities at these CCRCs
Yes.
are really great.
yeah. The activities at all of the places are great. I mean, the amount of money that these communities are investing in programs and bringing in Gary Highlander and bringing in, one place has a grab your passport program. And every month they feature a different country, and all the staff dress up from that country's, in the country's colors. They do the food from that country. They bring in dancers from the country, do a slideshow, have a lecture. The whole idea is to keep you engaged and having fun. And if you're not there, you may be at home with a caregiver, perfectly happy watching TV all day. Thank you very much.
Yeah, the one I look.
I mean, obviously, I am an advisor, and if that's people's decision to stay home, as long as they know what their options are and know that financial break-even point, that is absolutely their decision. But I want them to know what they're deciding against. You know, just look at all your options.
Right, right.
Yes.
I have two questions, and I promise I'll let you go. One is, questions call, what is your fee if somebody calls you and asks you to help?
We are free.
Oh, okay.
How does that work? So what's the best analogy? Like a executive recruiter in human resources.
Okay.
So if somebody's doing a job search, he'll hire an executive recruiter firm.
Oh, right.
The executive recruiter firm will go out and find the right company that fits for that person's skill set. And then the company that hires the person pays the executive recruiter.
Right.
We're like that. So when and if someone moves, we're compensated by the community. But I can talk to people for a year, and they may decide to stay home, and that's okay, because I've hopefully helped them navigate their options. And then I can actually never meet the people, and I will get a call from a social worker or from a frantic adult child whose loved one cannot go home, and we quickly help them move in. So that's how it works.
Okay, and my second question, there's a whole lot to understand here. I don't suppose you have a checklist of, these are the questions or the things you should be looking for. I mean, most of it is in here, but I'm gonna have to go through it and write it down.
What I generally advise people when they go looking is to ask a lot of questions about their own situation. The Massachusetts Assisted Living Association, MassALA, has a guide to assisted living. Okay. And it has a series of questions in the back and kind of a checklist.
Okay.
I always advise people to go in first and just sort of take it all in, go home and read all the material. If someone is working with me, I will help them come up with a list of tour questions specific to their situation.
Okay. Thank you.
You're welcome.
Mala, which means bad. A wicked.
I just want to make a comment on assisted living. Assisted living is not regulated by the state.
Assisted living is not regulated by the
The
state.
only people that are regulated by the state are the long-term care facilities, skilled nursing.
Skilled nursing facility, yeah.
Right, and I had occasion to go into an assisted living facility where a friend was, had dementia and was going downhill. And they had to hire, private nursing because they didn't have anybody they didn't want to move her into a skilled nursing facility.
Right.
So people should be aware that, those facilities aren't intended for people who really need care, full-term care.
So the difference is if someone needs a ventilator and they need a nurse and they need wound care,
Yes.
then they are probably better suited for a nursing home, because assisted living is not allowed to do wound care. The nurses, even though they know how, they're not allowed to do it. So when you said it's not regulated, it's not regulated to the extent that nursing home is, but all assisted livings are subject to a survey. So people will go in, the industry goes in and actually has a set of standards and criteria that they do grade the assisted living on. And if they get knocked down in a certain category, they need to show how they're going to improve that category. But it's not regulated to the extent that skilled nursing is.
Right, and if you're a family member and you have a family member in one of those places, then you need to understand that you have to bring your own nurse in and, you know, and
So
I know
that's-
that's been done, I've
Yep.
seen it. yeah.
Yes, so that's done a lot. So the big question to ask when you go in, because all the places have different levels of care, the $1 million question is, $2 million questions. What happens when I run out of money? And at what point can you not care for me and I'm gonna have to leave or bring in private care?
That's scary.
So those are two questions that you must ask. At what point can you not care for my loved one? And will I be required to bring in private care? Yep. So now everybody's in a great mood, ready to go out and explore your options.
Can I just say one thing? So I'm the planning director for Foxborough, and you might have seen that we are getting ready to talk about housing. And the main reason we're talking about housing is this lovely lady here, Evie, she's been coming into my office for a couple of years talking about the plight of seniors.
Great.
And so that's something we're real sensitive to. You know, the town manager comes here every month and we hear that. What's interesting to me about hearing this, though, is that sort of the haves and the have-nots. And that's the hard thing to manage here, is like, how do we meet such a range of needs? I mean, some folks have the choice to stay in their home and pay for care. And those folks, it's a little different, because that's just like, that's all choice. Then I feel, you know, I hear this woman here saying, well, you know, what about if you can't afford $2,000 a month? Which I think is a lot of seniors, you know, and it's too late now to suddenly come up with a, you know, a pot of gold and spend it. So I guess to those here, I'd say please participate as we go, because senior housing is what we're really trying to focus on. We don't have the answers yet. One of the hard things that I was just saying here is that, like, it's weird to me as a planner, because Foxborough is a town that actually hasn't only allowed single-family homes. You know, like I came from Rentham for 10 years. They only allowed single-family homes, maybe a duplex here and there. So I understand why their housing is very expensive and very limited. They only built really one kind. Foxborough, interestingly enough, built quite a bit of different kinds of housing over the 70s, 80s. They have apartments, they have a full stock, and yet it's still so expensive.
Yeah.
So that probably goes to our region, goes to our land costs, and it means there's no easy solution, because it's all the mighty dollar, unfortunately. Developers aren't going to build unless they're going to make money. So no matter how nice they seem to be or whatever. So we are working with a few, trying to talk about different models, trying to find ways, but it is difficult.
Make sure seniors are included in on that too.
Well, that's what
On
I'm
the
saying.
committees
You're
and
on the
things.
committee, by the way. Did you know that?
I heard from, I'm not sure which committee, but.
My committee.
Oh,
You were
okay.
the first one I put on there. You don't know it yet. That's because
That's fine,
because
good
everyone's
choice,
coming in
right?
talking
Yeah.
about housing, and we really want to get the word out. And you guys really are the drivers, because most people are, not that they're okay, but there's a lot of people in town that are just all set. They close the door behind and let's be done. But the seniors are saying, we're not okay.
Right.
We don't have anywhere to go.
Right.
And, you know, we
Right.
have Walnut Street over there. We could build something, but that's going to take years. And that's going to, you know, the wait list is already several hundred long. So, again, there aren't any easy answers, but it's a conversation we're trying to have. And, you know, it might be that the seniors have to lobby at town meetings, because we don't know, you know, it might take some innovative thinking to how to
Yes.
get housing for folks.
Yeah.
And we're thinking of it, but I hope you'll all be involved. Feel free to join up in this, you know, come to meetings. I can have meetings here. You know, we want to reach out to you guys. So, thank you. Thank
You know, a very simple thing in, oh,
So even, no,
very simple thing in the town. I heard of someone that was moving in and they were living in the basement of their child's home.
Yep.
They were not allowed to have a small stove. That has got to, something has got to be done about apartments where you're bringing in a family member and they want to have their privacy and they want to be able to cook a little meal by themselves and they can't. You have to get you cannot get a permit.
Well, we do have the ability to do an in-law with a stove and its own kitchen, but you have to get a permit. So I don't know if maybe
They're
those
not
people
giving the
couldn't.
permits, yeah.
Oh, no, we give them out. My office does it. We give out
Even
accessory.
Well, maybe it's.
It's probably a circumstance.
Yeah, right.
And I agree. In fact, like, I was just saying to Joan here, like, I'm a single woman living in a big house in Franklin, 2 kids that are almost out, and my mortgage is only $1,250 a month. I can't afford to downsize. I would love to. Now I forget my point. Oh, I know what it is. I have a pool. I have a pool house in my backyard. If I could just make that pool house into a little, like, apartment, little cottage for someone, whether I lived back there and rented the house out to a family, or whether, you know, I just rented it out and it let me pay, you know, pay the bills. Not that that's really the problem. I really don't want the house and the yard. But so that's the point, like,
Yeah.
little thing. But that's a mindset. So you're going to get folks to come to town meeting who are afraid of that, because that sounds good in theory. But if someone tries to do it next to them, forget it. So this is where the conversation comes in, is a lot of fear. And people are afraid that if someone allows a stove in their basement, then suddenly a real estate agent is gonna sell this as a two-family, it's gonna lower their property tax values, they're gonna lose. So it's fear, but it is something we can deal with, and we could certainly find ways of accommodating that. And that's, I think, something we have to talk about.
We're here, because there's a lot, the seniors in Foxborough are very social. If you're not, it's your own fault almost.
Yeah.
Because people reach out to people.
Yeah.
and it's-
Right.
This is a tremendous resource as a start. We have
Yeah.
great people. and
You
we
do.
have you in
And
town
what I've been
planning it.
noticing about Foxborough, because I've been a planner for 20-something years, is people in
But she's
Foxborough
new here.
well, I've been here 3.5 years now, but, not that new, but I'm still a newbie in town. But, people in Foxborough really are passionate about Foxborough. Like, I've been in other towns, and the hard thing is talking to the seniors who say, how can I stay in my town? Like, you're living in a big house.
Yeah.
Where can you go, you know? I
Right,
mean,
right.
you're lucky you can.
Right.
But, some can't, but like, you don't have any options, you
That's
know?
right,
And
that's it.
how can we accommodate, do you have to move to Mansfield? Do you have to move to Walpole? That's
No.
sort of what we're trying to figure out.
Mansfield's pretty good.
It is, but you're not here in Foxborough, and people love Foxborough.
That's right.
They wanna stay.
I got a place, I haven't put my deposit, I'm doing that next week.
She's doing her homework.
So, there's no question the industry needs to change. The senior tsunami is happening, and they're very, very expensive places, and something's gonna have to change. Any other questions?
I just had a comment.
Oh, yes, I'm sorry.
Okay,
I
got
put
it.
you on hold.
No, this is just an aside. Someone came and mentioned, I said, well, you know why? If they were taking care of an elderly woman, another 101-year-old, and they were doing it in their home, and they were struggling. And she said, well, I wouldn't be entitled to get hospice for her because I mentioned hospice. She was under the mistaken idea that someone absolutely had to be done guaranteed within 6 months. And, or have cancer. I said, she's dying in a old age. She's entitled to hospice. And if she's not gone in 6 months, not to be crude saying that, they'll extend it.
Right.
Oh,
Yes.
sure. And I said, you just need to get on the phone and
Yeah.
talk with them and find
Yeah,
out.
I would think that the social worker here could help.
So, no, they live
Oh,
in,
somewhere else.
Hillsborough,
Yeah.
but she did get on the phone.
Yeah. So there's a lot of information out there. Some of it is right, some of it is not, but, yeah. So you guys have been great. A lot of times
Very
people don't
informative.
ask
Thank
any
you.
questions.
Thank
so-
you.
Oh, you're very welcome.
Lucia?